Hey, I'm Tilly, and if you're watching this, the likelihood is that you're probably going to have ACL surgery or you've had ACL surgery. I know firsthand just how tough this surgery and rehabilitation process can be. After having my own ACL surgery and becoming an ACL specialist, I wanted to help more people than the people that I can just help within my clinic. And that's where I created my Complete ACL Recovery Guide. I work with so many patients, probably just like yourself, that have been given outdated treatment. They're on this path to nowhere, and they just cannot see the wood through the trees. So, what's in the guide? Lots of people ask me this question. I wanted to make something that makes my patients feel empowered and in control of their own rehab and their own destiny, and actually learn about the rehabilitation process. Since creating the guide, the results and the feedback has been absolutely amazing, far better than I could have ever anticipated. It was a guide to help empower patients have access to good quality rehabilitation regardless of your situation, whether that's time or finances. The Complete ACL Rehabilitation Guide is a full step-by-step program to get you back to the sports that you love. The start of the guide speaks about tips and tricks, so how to regain extension, how to regain flexion, how to manage the most important thing, and that's swelling, how to manage pain. And within that first part, it's all of my knowledge, what I've poured into years of practicing with ACL rehabilitation. The second part of the guide is all about levels, so it has different levels and different stages. You can't pass out of the stage without passing the levels of progression, and each level has exercise workouts that you do which have clickable links so you can watch them on YouTube to know how to do the exercises. It has the repetitions and the sets, and it also has exactly how to do them, when to perform them, etc. The bottom of the page, it tells you when you're ready to progress to the next level by doing X tests. So at all point you know exactly where you're heading and what progress looks like, what should it look like to progress to the next phase of rehabilitation. As you progress towards the end, we start to look at return to run. So you have all of my return to run tests, you have my return to sport tests, and you have all of the forms in there, like mental readiness forms. These are the things that you must be doing before you think about running or returning to sport. That, in a summary, is what you get within the ACL Recovery Guide. Now, I get some very common, frequently asked questions, so I'm going to run through those now. A really big one is, I'm X amount of months post-op, so that could be 3 months, 6 months, 9 months, can I get the guide? And my answer to that is, are you happy with your current rehab plan? Are you progressing in a manner that you are happy with? And generally people say no, and I don't think my therapist is telling me the right exercises to do. So my answer to that is absolutely get the guide and work through the guide and have a better understanding of where you're at, and start to use the progression markers and the targets to basically adapt and change your rehabilitation. Because if you're not happy and you're not seeing progress, the likelihood is the guide is absolutely perfect for you to start making progress. And lots of people have got the guide at 6 months, 9 months, and seen such a big change to their rehabilitation. Second question that I get is, can you use the plan if you've had all different types of ACL grafts? Absolutely, yes you can. It caters for all within the guide, so that's hamstring graft, patella tendon graft. And do remember as well, I'm always on hand. I'm only a WhatsApp or an email away with any questions once you've got the guide. The third most occurring question is, I've had meniscus surgery as well, or a meniscus repair with ACL rehabilitation. Will this guide work for me? Yes, the guide will work for you, but what you must be aware of is your post-operative protocols. And regardless whether you have a plan online or a plan with a physio in person, you must have those anyway, because every surgeon varies. So their protocol might be that you can't walk for 2 weeks or even 6 weeks, or you must avoid deep knee flexion for X amount of weeks. So as long as you know those post-operative instructions, you can absolutely use the guide, because you just follow them within the guide. What makes my guide stand out is it's not just a list of exercises. It's not like loads of different clickable complex links. It is on one document with, I think it's 85 pages. It has everything fully explained, safety when it comes to de-acceleration, how to jump and land properly to avoid re-injury. You get all of the goals, all of the progressions to make sure that you're on track and make sure that you're progressing the way that you should be. As I said earlier, I'm only a text or only an email away. The whole reason I made this guide is so that you guys can all feel ready and in control of your recovery, and literally put the recovery back in your hands with a plan that you feel safe, and that you feel confident in, and that you get out of bed each day looking forward to going and doing these exercises within this plan. Watch this video and you still have some questions regarding the plan, please feel free to reach out, because I'm sure I've probably missed things, but it's a complete ACL recovery guide. There's nothing else there on the market like it, and for £89 it's an absolute steal.